what the school can do better to foster more wellness. I feel like they're on the right track with the school-based mental health and wellness piece with having clinicians on site. And the reason why I say that, I just want to say, is because when I was going through what I went through when I was in school, when my mother passed away when I was 16, I got pregnant a month after my mom passed away. And no one pulled me in the office. No one asked me if I needed therapy. No one asked me if I needed any of those supports. It was just go to school, get your education. But there was more going on. And so mental health and wellness is absolutely important for the students to have that available to them on site. But I think it's also important for them to have substance abuse counselors at the schools. And I think that's something that's often overlooked, because substance use is kind of the black cloud that people don't want to look at. But the reality is, if we can address it now, if we could do intervention now with students before they get to a point to where I was, then we have absolutely been able to do something huge. And I think to know if you have substance abuse counselors on site, or at least in districts that can be called out to work with students, certified drug and alcohol counselors to work with students to help them learn about the disease of addiction, how it manifests itself, and how they can work on being clean and sober, and how that little innocent vape can turn into a whole lot more. And not saying that vaping is innocent, I'm just saying kids look at it as innocent. And it really isn't. It's a prelude, I guess you can say, to more things. It's a starting point to begin to say yes to other things, and it's not addressed as much as I feel like it should be. I don't think there's a lot of substance use disorder support in the schools, which is not good at all, because the vaping, the smoking, the weed, the drinking happens daily with at least 4 to 5 kids at the schools I work at per day. And so with that being said, that lets you know that there definitely is a concern and an issue that needs to be addressed. And they need to think of it different from the way we thought about it in the 80s. We need to think about it different from the way we thought about it in the 90s. We need to think about it different than the way we thought about it in the early 2000s, because now we're talking fentanyl. Now we're talking things that you may not be able to come back from. So I think it's important for us to really, really focus on putting substance abuse counselors in schools.